Hi there, my name is Sharon Whiteman. It's my pleasure to introduce you to Lyme-like illness in Australia. Firstly, I'd like to start by thanking you for giving some of your time to review this information. It's really important, and it obviously could be affecting someone that you love and care about. I'm currently the president of the Lyme Disease Association. I'm a Lyme patient, mostly recovered or partially recovered. I'm a mom, and I'm also a business owner. So Lyme disease is an infectious disease. It's caused by bacteria from the genus Borrelia, can be known as Lyme borreliosis, and it's also considered the fastest growing vector-borne illness globally and is found on every continent. It's first thought to only be one pathogen causing the Lyme disease symptoms, but science is progressing, and recent science is indicating that there's multiple strains of Borrelia involved. It was originally named because of the U.S. city Lyme, Connecticut, where it was first isolated. But with no contemporary research in Australia, Lyme-like illness is the favored name. It's transmitted by vectors, insects, so typically ticks. But as, again, research progresses, they're finding it in mosquitoes, in bed bugs, in midges, all different kinds of ways to transmit. Globally, it's considered to be preventable and treatable by the World Health Organization. It's the fastest growing vector-borne disease. Up to 300 strains of Borrelia are reported globally, but unfortunately not all have been tested for their potential impact on human health. It's also considered its increasing incidence as an indicator of climate change. Germany is estimating 60 to 100,000 new cases. The US is 300,000 new cases annually. China indicates 5% of their population could be affected. Anywhere birds can fly, Borrelia could travel, is because birds can be hosts for ticks as well. So Borrelia has been found in seabirds in the Antarctic. In 2015, a California study showed 57 out of 100 birds with ticks on them tested positive for Borrelia, and a recent Canadian study showing Borrelia burgdorferi ticks on migrating songbirds. To my knowledge, we don't have any bird research into ticks. Australia also has multiple deer farms which could be implemented or indicated rather in this problem in Australia. We import cattle and horses. There's no border control or any check for ticks. Other suspected vectors, as I was saying, can be mosquitoes, mites, fleas, sandflies, and even bed bugs. The U.S. situation, they have upregulated their incidence from 30,000 to 300,000 annually. If you look at this quick chart, really it's completely outstripping HIV and breast cancer, which, as you can imagine, Lyme has no funding, almost no awareness, especially in this country. Australia, Lyme disease has been diagnosed in every state. Over 1,500 medically confirmed cases have been reported to us. Doctors indicate that they're treating more than 4,000 on their books past and present. Australians report being infected both in city and bush areas alike. Tick bites can occur at any time of the year. 70% of our 2012 survey respondents do not remember a tick bite, and 25% had never left the country. And we actually, when the research progresses here, we expect the incidence in Australia to be similar to the US. Our 2014 patient survey, this is our mini survey showing these houses indicate a home in Australia where someone has a medically diagnosed case. So they've seen a doctor and the doctor's confirmed their situation with Lyme disease. So as you can see, it's pretty widespread, and prevalence in the coastal areas is higher. You can see here that there's 6 past indications of evidence of an Indigenous or an Australian Lyme situation. And then in 1995, a study was done that seemingly negated anything previous. And they said they looked for 3 strains of Borrelia, and they couldn't find them. They did find spirochetal artifacts, which the Borrelia is a spirochete-shaped bacteria, like a spiral, but no further review was done on that evidence. Fast forward to 2015 or 16, Professor Peter Irwin out of Murdoch University has done several studies, and just in brief, the outcome is that they find 5 brand new pathogens, one of them being a relapsing fever type Borrelia off ticks that have come off echidnas. His research is continuing. The other thing is Lyme patients did their own research. You'll find that Lyme patients can be very independent, and they have to be because they can't get help here. what they uncovered is that our blood testing was not working in Australia. So that one lab, Westmead lab test for a North American strain, plus one European. Palms lab tested for one North American plus two European. They gave different criteria for a positive. And Westmead concluded at one point that approximately 900 Australian patients would have received positive results had the lab used the same methods as Palms. So there was discrepancies. We do have a Lyme specialist lab currently applying for NADA accreditation, and that's Australian Biologics. In 2012, a clinical advisory committee was convened, and it wrapped up in 2014 with very little progress. Both sides of the story were very entrenched in their position, and there was no budging. So Professor Bagley, the immediate past Chief Medical Officer of Australia, he concluded that there is a Lyme-like illness in Australia, that blood tests, while they're relied upon by doctors, they're very unreliable. He committed to addressing the blood testing inconsistencies. That was 2 years ago. That's still underway. He outlined research priorities, but there was no budgetary support for that research. And he committed to a tick bite awareness and prevention campaign in conjunction with the state and territories. And I understand that that's still under progress at a bureaucratic level. So as of June 2016, really, while work might be happening behind the scenes, nothing has changed for patients, and patients are suffering, and in some cases, sadly, they're dying. In 2015, with that lack of obvious or visual progress, we reached out to Lyme patients and their family and friends and asked them to send postcards, educational postcards, to their local MPs and senators. We had an overwhelming response that over 20,000 postcards were posted in the month of May 2015. And then our team currently followed up with the MPs and senators, and the outcome of that was that there was a House of Representatives roundtable in September 2015 and a Senate inquiry into Lyme-like illness that commenced in November of 2015. Now, the House of Rep has published their findings, and the Senate inquiry was seized due to our recent double dissolution election, and we're continuing to engage with the incoming senators to ensure that we get the inquiry resumed, which was one of the recommendations of the past Senate committee. So we assert that a single 20-year-old research or 20-plus-year-old research study should not be used as the basis for ruling out the possibility of Lyme disease or Lyme-like illness in Australia. There's no argument from any side of the camp that Australians are sick after tick bites. There's no scientific validity in denying positive blood tests in people until spirochetal evidence is isolated in ticks. There's lots of patients who have positive blood tests, but because the decision makers are waiting for evidence in a tick to prove that tick have the ability, our Australian ticks have the ability to sustain these pathogens, then those positive tests are denied as false positives. So you can understand that be very concerning and very sad and tragic situation for Lyme patients. In consultation with ELADS, which is the American and International Lyme Association for Lyme disease, they consulted with us and said, in Australia, we've got an emerging disease situation. And in an emerging disease situation, patients should be treated with the best of the knowledge of the day while research is urgently prioritized. And in Australia right now, we can test that we are the evidence. We're sick. We've got positive blood tests. And we need to urgently prioritize action for patients, training doctors, supporting patients, and prioritizing urgent research. And we like to say thank you to the New South Wales Country Women's Association. They've donated to the Lyme Disease Association, and we'll be having an epidemiological study commencing in the coming months. So how Lyme disease shows up in a patient. So the early symptoms can be flu-like, fever, headache, swollen glands. There may or may not be a rash like the one pictured, or there can be very different kinds of rash depending on the pathogen that actually is contracted to the person. And only 35% of patients in our 2012 survey indicated that they had a bullseye rash, which is the one that you see pictured. Bacteria quickly spreads into tissues and organs. It can spread within minutes to hours. It's typically, unfortunately, again, for patients, an invisible illness. You can look at a patient, they in some cases look fine. Unless they have the neurological progression, you won't be able to tell by looking at someone. It's very often misdiagnosed as multiple sclerosis, rheumatoid arthritis, Alzheimer's, motor neuron, Lou Gehrig, Parkinson's, lupus, chronic fatigue, sarcoidosis, ADD, autism, and more. So ultimately, they get grouped depending on what their symptoms look like. And in a Lyme disease patient, symptoms can change, and they can be very different in each patient depending on where the pathogens gravitate to. So if you are someone or know of someone who has one of those diagnoses or more, and typically it's an atypical diagnosis, then those people have the right to be assessed with Lyme disease included as part of the differential diagnosis. Then there's the co-infection. So it's not just Borrelia. There's usually a cocktail or constellation of pathogens that are transmitted. So again, that further complicates the presentation of the patient, doesn't it? So there's a very varied and complex presentation to the doctor. And so they, with the education that there's no Lyme disease here, that you can understand why they'd be sent off to neurologists or, specialists, depending on what their symptoms are. The immune system becomes very overwhelmed very quickly. These are stealth bacteria, and they can be, some people can have very mild symptoms, but some people are very extreme and are completely incapacitated. And sometimes they can come and go, which is also unusual in medicine. Therefore, doctors tend to blame the patient in those situations. The other thing is each of these varied pathogens require different treatment. So again, it's a very complex treatment protocol and knowledge base that's required. So it's tricky to diagnose. International best practice says that Lyme disease is a clinical diagnosis. So a Lyme-aware doctor looks at their history, their symptoms, and a clinical exam. It's helpful to have a positive blood test, but a negative result does not preclude Lyme disease as being the problem. And again, we can repeat that Professor Bagley said Lyme disease blood tests are relied upon, but they're unreliable. So if you know someone who's had a negative blood test, doesn't mean they don't have Lyme disease. The challenges with blood tests is, again, very quickly the pathogens move out of the blood into tissues and organs. Some of the tests monitor the immune response, and Borrelia in particular very quickly overwhelms the immune system. There are 14 known genospecies of Borrelia, but estimated more than 100 as indicated, and only 2 or under 5 are looked for in some tests. And the other complicating factor is, the Murdoch Uni research is showing that we've got unique, just like our animals in Australia, we've got unique pathogens here as well. So you can't test for something that you don't know what it is. So it's early treatment. They need a minimum of 6 to 12 weeks of antibiotic therapy, a 2-pronged antibiotics, and it should continue beyond symptoms. Late Lyme disease is tricky. It's a marathon. It requires a combination of therapies. It must be individualized, so there's no one way that, I know people who respond well to antibiotics and others who respond better to herbs, so it needs a very Lyme-aware and experienced doctor. You must include integrative therapy, so nutritional and detoxification support for the body. In my experience, peer support for both family and the patient is as critical as having, a knowledgeable doctor. And unfortunately, for very late Lyme disease, which is very common in Australia, it can extend for years or forever, and 100% recovery may not happen. But I'm not 100% recovered, but I can tell you I'm not praying to die every day, and I have quality of life, and I have, quite significant functionality, which I didn't in 2004, 5, and 6. And unfortunately, we know of over 20, almost 25 people who've died in the last 3 to 5 years from untreated Lyme disease. The impact, our survey shows that over 50% of people travel more than 50K for treatment. And in that case, in that time, 9% traveled overseas. That's much higher now. We haven't analyzed our last survey for those figures. There's 130 patients that have reported to Germany up until last year. Approximately 70% of all patients had to take time off work or school, and 50% had to quit their jobs. 38%, this is really important statistics, report having suicidal thoughts. Sadly, people report having a significant decline in their quality of life, gross deficits in their functionality. incredible social isolation is reported by most people, and most families and patients have their financial situation completely wiped out. The other thing is, this is a U.S. Lyme organization statistic. Chronic Lyme patients suffer worse quality of life compared to other chronic diseases. So 72% disability on the left hand there, that's chronic Lyme disease. And you look, congestive heart failure, fibromyalgia, diabetes, MS, depression, asthma, and the general population. These people, when they say they're sick, they really are sick, and it can be proven. There is good news, though, that with treatment they get better. Even if they're not 100% recovered, like myself, I'm probably 60 to 70%. And like I said, I have quality of life again, and I can contribute, which for me is a very important aspect of my life and my happiness. So if you know someone who has had symptoms following a tick bite, seek informed assessment. You might have to be persistent, because most physicians are trained that Lyme is not in Australia and thus have no treatment or knowledge base. And some of them who recognize that these people are sick, they feel lacking confidence to treat effectively as well. So if you have one of the diseases I mentioned that Lyme disease can mimic, persistently seek support to be reevaluated, including Lyme disease as part of the differential. Peer support is essential, and thank you. If you're listening to this, you're one of these who are advocating for and supporting sick members of your family and community. The best way to not get Lyme disease is to prevent it. So be aware of ticks, wear light clothing, hat, pants tucked in when you're in the bush or gardening, or even running or playing sport often. You have to be very careful. Use insect repellent, check your body for ticks. Dry clothes in a hot dryer for 10 to 30 minutes. Unfortunately, ticks don't die just by washing your clothing. To date, there's no research available for safety of putting anything on a tick. A stressed tick injects more saliva. I know there is some education in Australia around a freezing spray, and that is currently being reviewed to determine via research, evidence-based, to make sure that when that spray goes on, the tick doesn't inject more. So as to date, the best advice is a needle nose tweezer or the claw type removers, because if you get as close to the skin, not squishing that tick to cause it to be stressed and inject more pathogens. These are really important points. Understand that not all Lyme professionals are Lyme aware. You'll have to be persistent. There's also no one right doctor for every patient. You have to find a match for you. Remember that blood testing is unreliable. So if you have a negative blood test, it doesn't mean that you do not have Lyme disease. Most people have a misdiagnosis before, and usually our surveys are showing multiple. I had about 5 different diagnoses before. Through my own research, I diagnosed myself and sent my blood overseas. Always treat if there are symptoms after a tick bite. And there are varied medical opinions on treating with no symptoms, so prophylactically treating every tick bite, but that's something to discuss with a Lyme-aware doctor. The sooner you start treatment, the better the outcomes. Do not stop treatment with active symptoms present, and make sure you let others know about this. So the Lyme Disease Association, we're a small yet powerful health charity. We're powered by volunteers who represent the immediate and future needs of Australians with Lyme-like illness. We collaborate to lobby the government and educate the public, advocate for early diagnosis and treatment, liaise with and fundraise for education for doctors and allied health professionals, and facilitate improvement in quality of life for people with Lyme disease. You can help too. Spread the word with what you've learned today. Volunteer and donate. There's a bunch of ideas on our website as how you could help out. And give us a call. If you have any questions or if you'd like to give us a hand, we deeply appreciate it. So I'll finish here. I want to thank you for listening. Truly, the most important thing is to be aware of Lyme disease so that people can get early diagnosis and treatment. And bless you for being here. Thank you.